Ding. Okay. Do you guys see like a recording meeting? Okay.
Mhm.
Awesome. Let's see. How many people do we have? 17, 18. Okay, we'll wait like another minute and then we'll get started.
Sure.
Yeah. Okay. Awesome. Yeah. Where are you calling in from, Michelle?
I live in Texas, in the
Oh,
Fort Worth
cool.
area.
Awesome. I was in Texas for spring break.
Yeah, what part?
We were in Galveston for most of spring break, and then we went to San Antonio on the way out.
Yeah. Galveston's where I went to PA school.
Oh, cool.
Yeah, UTMB on
Awesome.
the island. Yeah.
That's great. Yeah, so I'm sure you'll tell us more about that in a little bit. So, yeah, we can get started. Welcome everyone. Today is April 19th and we have our meeting. So, just a few things to look at. First things first, exec announcement. Last meeting, I told you all that we have 3 positions open for the next school year. If anyone's interested in becoming more active in PPAH, we currently have the position secretary, tech chair, and assistant to the president open. Applications will be due on April 30th, so I think that's in a week, but feel free to send them in sooner if you would like. That link is in the last email. I'll also link them in the email announcements today. Yeah, we also will be having a fundraiser at Scented Leaf on May 3rd. So that's super exciting. We'll make a flyer and send that out to you guys as well. But just mark your calendars for May 3rd so that we can try to raise as much money as we can to have a super fun social in the fall. And yeah, that's pretty much it. Today we have Michelle Cameron coming in and talking with us. So I'm going to let her take the floor. And yeah,
Yeah,
thank you for coming in.
give me 1 minute. I forgot I wanted to copy a link really quick. Let me do
Yeah,
that.
no worries.
So I can drop it in the chat.
Sure. Yeah, while you do that, I'll find the link for exec applications to send in the chat as well. So we have some cool things happening.
All right. Okay, so I was gonna talk for about like 30 to 40 minutes or so, and then I figure I just open up for Q&A if people want to ask me about anything. I'm willing to do that. Before I kind of get into the talk, I just want to kind of introduce myself and tell you why I'm speaking to you today. So I'm a PA. I went back to school as an older adult. I did undergrad in my late 30s and PA school in my early 40s. I graduated in 2015 and pretty much I worked family practice and urgent care mainly the first couple of years. Um, got a little frustrated and disillusioned with medicine, to be honest, and I'll talk about that a little bit. And so then I started working locums. And for those of you who don't know what locums are, we're kind of like the temporaries of the medical world. So if providers are out on maternity leave or if a clinic has, let a provider go and they don't have a new provider yet, we fill in that gap. Or if a clinic is just so busy that they need extra help, they bring on locums. And you can work all over the country, doing that assuming that you have the correct license for that state. Um, so I did that for a while. I also did a stint as a contractor with the military down at Fort Hood. And just recently did some training to become a hospitalist PA, where I'm going to work PRN just kind of, as they need shifts picked up. The main thing that I do right now, though, is I have a YouTube channel for PAs and NPs where the purpose of the channel is to help people who are PAs or NPs or who want to be PAs and NPs understand all of the different possibilities that are open to us out there in medicine. Kind of came out of my desire to find my fit in medicine, and that was the link I was looking for to get for you. The channel is called the Medicine Couch, and I just put excuse me. Excuse me. And I just put the link there in the description box for anyone who wants to to check it out. There's a lot of things that we're going to talk about that I have videos about there. So if you want more information, you can go there. Um, so I have done many things in my career so far, but I also have that unique perspective of having interviewed tons of people on my channel already. So I have all of their experiences and things that I can kind of conglomerate and share with you as well. So there's three basic things I'm going to talk about today. I mean, there's a million topics you could pick, right? But I narrowed it down to three. The first one is going to be kind of just talking about some of the opportunities, the amazing opportunities that PAs have for career options. And then the second one is going to be talking about, the downsides of medicine and making sure that you're really sure that you want to go into medicine. And then the last one is just going to talk about the patient care experience that people always ask about for they're trying to get into PA school, because people always ask the wrong questions about that and look at that wrong in a wrong light. So I'm going to talk to you a little bit more about that. So first of all, let me look at my notes here. I want to talk about like the career options for PAs. I mean, most people have a good idea of the general stuff, work in family practice or urgent care or ERs, or even in just the general specialties like cardiology, orthopedics, GI, ENT, all those, neurology, those kind of base specialties. But I think it's really important for people to know and understand that as far as I know, there is not a specialty in medicine where PAs cannot work. And I bring that up because I've been told actually by a couple nurse practitioners that I was looking to interview and I asked them to talk about, PAs in that role as well. And they're like, oh, PAs can't work in that. One was addiction medicine and the other one was working in the NICU. And they're like, no, PAs don't have enough training or they don't get trained to do that. And I'm like, no, that's not right. And so I did some digging and made sure and found out that they are in fact wrong. And in fact, I've done interviews with people working in the NICU. I haven't done addiction medicine yet, but I've talked to people who definitely work in addiction medicine. So just know that don't let people tell you that along the way in your path that you can't work in a particular area of medicine, because we're everywhere. We're even in ophthalmology. I did an interview with a PA who works in ophthalmology. I didn't even know that we did that. He had to do a lot more training and in-depth learning on his own, and he had been an ophthalmology tech. So it's not just it's not like anyone can just walk in and start being an ophthalmology PA, but it's just to show you that we can work in anything. So, think about all the other specialties too, and the subspecialties like cardiology. You can work in electrophysiology. You can work, in just the congestive heart failure clinics, where you're just doing one particular thing. There's lots of different areas that you can get into in the specialties and the subspecialties. And somebody said, can PAs work in hospice care? Absolutely. Yeah, PAs definitely can work in hospice. And that is going to be a growing field for sure. As people, our population is aging, there's going to be a lot of older people, they're living longer. So definitely something that's needed. So they can work in hospice care and in palliative care, which are kind of two different things. And so think about all of the other subspecialties, like they mentioned, hospice care, sleep medicine, in oncology, surgical oncology, plastic surgery, aesthetic medicine, so doing Botox injections and face fillers and things like that. And there's even someone I interviewed that works in breastfeeding medicine, which is kind of a new and upcoming specialty. So it's kind of like the lactation consultants, but they do more. They can prescribe medicine, like if the woman has mastitis and has a breast abscess or something, they can take care of that and treat that either through doing a procedure or medicine. So a lot of really cool things out there. And also I like to think outside the box, which is why I have a YouTube channel. But I like people to think about too the possibilities of making like niche practices within a practice. So, if you work in family practice for a while and then there's something you really like, if you are really love diabetes education, or if you really love doing, draining abscesses or whatever it is that you find, um, there's oftentimes in practices there are other providers who don't like to do those things, and sometimes you can carve out like your own niche practice and you can kind of create a career that is exactly what you want. And I think medicine is becoming more open to that, and you have to be creative and you have to, kind of forge your path. But just start thinking, you're way early in your path, but just start thinking about things you like along the way, and thinking, and don't ever forget in your mind that you can kind of create your own path and do kind of what you want in medicine. Because as PAs, we have that incredible flexibility. Um, oh, and the other thing I forgot to mention was labor and delivery. I see this asked a lot. People are like, and that was another thing I got told is that, oh, and I see PAs actually say this to other PAs. It's like, oh no, we can't work in labor and delivery. Why not? We deliver babies in our rotations. We have, women's health, and we are trained to do all that. And there are definitely PAs around the country that are working in labor and delivery. It seems to be kind of dependent on the area of the country. Like up in New York City, which is a PA that I interviewed who had worked up there, it is quite common in all the hospitals for the labor and delivery staff to be PAs. It's unusual for them not to be, but in other parts of the country, it is pretty much all certified nurse midwives. So, sometimes it's geography dependent, but there is nothing that says that you can't do that, and we get trained to do it. Um, so I think that was what I wanted to talk. Oh, and um, somebody asked really quick, well, actually, let me say before I forget. And so I want to say the one place I know we don't work is like dentistry. I've never heard of any PAs that work in dentistry, but if you're interested in the mouth, people don't think about ENT. They operate on the tonsils, they operate on the salivary glands, the parotid glands, they operate on mouth and neck cancers. So, you're all up in that area if that's your thing. Everybody has their own thing, their own part of the body that they really like. So this question says, for more niche specialties, do most PAs do a residency? And if yes, is that something that they must seek out on their own, or do jobs find residencies for them? So great question. And residencies are kind of a thing that people have different opinions on, because some people are worried that the PA profession is moving towards like going to need mandatory uh, um, residencies, and they're like, well, if that happens, then why don't you just go to med school? So there's, a lot of difference of opinion on that, but there are residencies for many of the specialties, but there's not residencies for all of them. And there's only a few programs. For some specialties, there's only like 2 in the country that, have a residency. Those are growing, and you'll see more in the future, but right now there's not a ton of them out there. So obviously there's not room for everyone to go into a residency, and so they're definitely not required to move into a specialty to have a residency. They definitely can be helpful, and they will teach you a lot of things, and you will feel much more prepared to step into a specialty. But honestly, there are some people that don't like to hire, some employers that don't like to hire people that come out of a specialty, because they feel like they're going to have to untrain you if you've learned, habits or learned things in a way that they don't practice. So don't get hung up on that. I mean, if you want to do a residency, I've heard great things about them, and it can really help you feel more confident and help you get a higher salary when you step out of one. But there's not a whole lot of opportunities there, and don't feel like that you're at a disadvantage or won't be able to get a job if you don't do one. So does that answer that pretty well? Okay. Um, so the other things to think about is like what kind of setting you want to work in. All of these specialties, or almost all of them, have like an inpatient section, or you can work outpatient, or you can do a mixture of both. Obviously, if you're going to work as a hospitalist, you are working entirely inpatient. You are admitting patients to the hospital and taking care of them there. If you're working sleep medicine, that's exclusively outpatient. So there are some that are just split, but there are a lot of ones that you can find opportunities to split your time if people like to have that kind of variety, where you can work, like in cardiology, you can work in the clinic for several days of the week, and then you could be working in the hospital, either rounding on patients or assisting in surgeries or whatever. And that pretty much, GI, orthopedics, all of that stuff, neurology, they often have people that do split their time between both. And there's also, for surgery, if you're interested in it, there are jobs where you are just basically a first assist, that you spend your whole time in the operating room. You just work with different surgeons. You may do some pre and post-op, but you're not rounding necessarily on the patients in the hospital. You are just there at the first assist. So it ranges from that all the way to, like I said, um, you know, being more clinic-based and helping out in surgery sometime, or being clinic-based and then just doing rounding on the patients in the hospital. So there's also a lot of, not only this specialty that you're in gives you flexibility, but you have a lot of flexibility in the setting in which you want to work in. Let's see. Sorry, I'm looking at my notes here. And so some of you may not have any idea really what area you want to work in, and that's perfectly fine. You won't really know, a lot of people don't know even as they go through PA school, or even as they find their first job or two, they're still not sure. They're still trying to find their place in medicine. But that's what's great about being a PA, is you have that time to figure that out. Now, for those of you who think that because there will be some people like, absolutely, I'm orthopedics all the way, or I'm doing emergency medicine, that is exactly what I'm doing. You might be surprised to know that almost all of the people that I've interviewed work in a specialty different than what they thought they were going to go into. So, you can be married to a specialty, but have an open mind, because you're definitely going to be shaped by your experiences in PA school, what rotations you have, kind of the mentors and the people that you find along the way, and then also just what opportunities are available to you when you graduate. So, be married to something, well, date something, but don't be married to it, because you could change your mind as you go along the way. So part of the reason that I want people to know about all these opportunities, and kind of why I started my channel, is like, I still don't think I found my fit in medicine. And it's hard, on rotations in PA school, you're going to rotate through a few different specialties, but there are many more that you are not ever going to be able to rotate into, because we just don't have the time. It's not like physicians where they rotate through like every specialty. So there are specialties you're not going to know about, and opportunities that you're not going to know about. And some of the things that I wished I knew before going to PA school, so I could kind of think about, planning my career in the future. And some of them have like age limits, especially talking about the military. So I missed out on a lot of the military stuff, or all of the military stuff, because I was already too old. Usually they want you, in before you're 40. And this is not a military or government recruitment video, but I do want you to understand some of the amazing opportunities, especially with the military, going to PA school through the military. And some people may not even really consider that, because they think, I don't, well, let me back up, because if you go to PA school through the military, you don't have to pay for PA school. You don't pay anything. In fact, you get paid while you're going through PA school. You will be making an officer's salary while you go through PA school. And the military, let me tell you, it has some amazing training. You will be well trained, and you will be a little bit head and shoulders above other PAs. But that whole deal of having your PA school paid for, you have to then return in your time. So, and I think it's 8 years that you have to give back, working in the military. But let me tell you, it doesn't seem like it probably at your age, most of you are in your 20s, but 8 years goes by really fast. And you will have amazing opportunities working in the military. You know, you can work overseas, you can work in lots of cool places around the world. But like I said, just the experience and the training you get is really great. So that's something to consider. And if you don't want to join the military, or if you don't want to go through PA school in the military, you can join after you graduate as an officer. You get, you know, loan repayment, you get a lot of perks, you get a great retirement, which is something that you don't find in lots of places. And then you also can work with the military, like I said, as a contractor. You can do that in the US or overseas. Um, so you're asking how the military training differs from a normal PA training. And some of it is just the exposure, the opportunities that you have to work on people that have, you know, unfortunately, that have traumas and things. You know, you'll have a lot more opportunities to learn that. But the military leans heavily on PAs. They're all, you know, obviously overseen by physicians that are medical directors, but the core of the military is PAs as far as the medical part goes. And so they just train, from what I've seen, I've obviously not been through training, but they just train you, I don't want to say more in depth, but your experience levels that you get while still being nurtured and mentored are a lot better than like regular PA school. So you go through regular PA school and you've got this, you know, these rotations that go by really fast, 3.5, 4 weeks at one place. And then you graduate and you're kind of on your own. And I'll talk about this in the next part. There's not like that whole great taking you under your wing and mentoring. I mean, those opportunities are there, but you have to be prepared that when you come out, they're going to expect you to, you know, be carrying your own weight pretty quickly. And the military, I just feel like not only are they training you really great on procedures and trauma stuff and all the stuff that we kind of gloss over in some regular PA programs, but they have more of that built-in mentoring that can help you grow and learn more as your career develops, and not quite just, you know, plopping you all by yourself somewhere. Now, having said that, you will work, if you're in the military, you will be working sometimes in clinics by yourself, but they do just a really good job of mentoring people. I hope that answers kind of that question. Um, and just to give you an idea, like of costs, like when I graduated, of course, this was my undergrad and PA school together. And I, being older, you know, I didn't have mom and dad paying for any of my schooling. Not that all of you are, but I know some people in my class, you know, mom and dad helped out. But I graduated with $149,000 worth of student loans, and I'm still at 75,000 still owed on those. So it's a lot. And so if that's something that, you know, is really important to you, please check out the military or check out the National Health Service loan repayment programs, because there are some ways to get your schooling covered and paid. And another thing that I want to mention about the military that's kind of cool is that some of you may be surprised to know that the president and the vice president are taken care of by PAs and NPs, but mostly PAs, because the White House Medical Unit is what it's called, that takes care of them, is staffed predominantly by PAs. They obviously are overseen by physicians, and physicians are the president and the vice president's, you know, personal doctors. But when you're on call and you're in the White House and they need you, they're calling a PA. You know, so, and I did an interview with a PA who did that job and who took care of several presidents and vice presidents. So that's another cool opportunity through the military. And then also, if you want to work overseas, some people think that, like me, mistakenly think, oh, I'll, you know, become a PA and one day I'll work overseas. Well, I didn't look into it. I didn't think about it. It's difficult, but it's not impossible. And uh, you can work directly with countries like New Zealand is actually hiring, some PAs. They're trying to start the PA movement there. You can work in the U.S. territories, like the Virgin Islands and Guam, things like that. But one of the greatest opportunities is working with the State Department, and you're not a military employee. You're working for the government, for the State Department, but you staff the U.S. embassies around the world. So you take care of the embassy diplomats and the staff that work there. And there are embassies in, I think, over like 140 countries, something like that. And those are totally run by PAs and NPs. Again, the physicians are higher level and they actually rotate over regions, but you there in the clinic, day-to-day operations, you are running the show. So that's really cool opportunity. And you only have to have like 5 years of primary care experience, but you have to be able to take care of OB patients and pediatrics as well. So it's things like that. Like I would love to do that job, and I still could do that job, but because the cutoff age isn't until like 60, but I'd have to go back, I'd have to find some OB and pediatric experience. But if I would have known that before I went to school, because that was pretty much my dream job. And again, I have a video on that tells you more about it, but I would have structured my career differently. So that's why I like people to be aware and to think about if there's something that you want to do, really kind of look into it and kind of know what your path maybe needs to be. And I try to do that in the videos when I interview people. I try to always ask them, like, what advice would you give people to prepare themselves to be able to get this job eventually? So you kind of like work backwards and structure your career, if that makes sense. There are PAs doing cool and unusual stuff all around the world. I haven't been able to get a hold of them, but I know of a PA who works on movie sets, taking care of the actors and the crew and stuff when they're out in remote locations. There are PAs that work down at the South Pole at the research station in Antarctica. I've interviewed him. There are two PAs that I know of in the country that are doing solo surgeries. They're doing organ procurement by themselves. There's not a physician in the operating room. Of course, these are patients who are already, pronounced brain dead, but it's still an operation and it's still an amazing job that PAs are doing on their own. And then lastly, I don't know if everyone knows, but there is a PA that just went up in space, and she was actually the medical mission specialist for the crew that went up in space. Haven't interviewed her yet, but she's on my list. So just want to tell you how cool the PA profession is and that there are all kinds of opportunities. So if you're worried about like if you'll find a job or if you'll be able to do what you want to do, there are absolutely a ton of opportunities out there, and I think they're only going to continue to grow. And then I didn't even mention non-clinical roles. So after you work for as a PA for a while, if you don't want to work clinically anymore, you can transition into research. You can work for pharmaceutical companies and be what's called like a medical science liaison, where you are teaching, you're not selling the medications, but you're teaching doctors and other providers about the medications. Or you can, transition into administration in these big medical groups and hospitals, or you can become a PA professor teaching, young PAs. So lots of opportunities there. So that's all the great side about, being a PA, but there are downsides to medicine, and I don't think that people talk about them enough. And I don't want people to think that I'm trying to discourage you from becoming a PA, but I just want to share some of the things that are the realities of working in medicine in today's world. So I don't know how much, people are aware and how much experience people have had, but medicine is a big business now. And, there used to be, or like you see on TV, these, doctors and PAs and then NPs and stuff are running around talking and having conversations and making out in, supply closets. And they have all of this time. They're out doing stuff. They go where they want to go and work on the cases they want to work on. But that is not how reality is when you work in medicine. You are pretty much just at the whim of the administrators. They're the ones that are going to tell you how many patients that you have to see. They're going to pretty much set your schedule. They're going to be, harping on you on billing and what procedures you can and can't do sometimes. You're also going to be fighting with insurance companies to just get basic things covered. They're going to be sending you letters telling you, oh, you need to change Miss Smith's medicine from, XY to Z because they've changed their contract with the pharmaceutical company and they don't make as much money on that other drug. So they tell you, you got to change this drug. It is maddening, just that part. And then, patients, we love them. That's what we're here for, is to serve them. But people are becoming more and more entitled. They think they know everything because they read it on Google, and they will argue with you. And they are not afraid to be vocal about the fact that they think you're wrong because of XYZ that they read somewhere else. Um, and they're also can be very obstinate about, that they're not going to do what you tell them to do, or, that they don't believe you or whatever, or they'll lie straight to your face. So, a lot of people know that that's nothing new. Human nature is what it is. But working with the public is difficult. So if you're somebody who doesn't like, those kind of interactions, then there may be places for you in medicine, but it's going to be difficult. And then just feeling like you're a cog, excuse me, feeling like you're a cog in the machine of medicine. And I don't know if people think about it enough, but we are the people that are bringing the money into the practices. It's our billing. Everything that happens in the practice, from everyone being paid, everyone, every staff member in the whole place, to the lights being paid, the supplies we use, all of that basically comes from what we bill. And that's why there's this pressure on us to constantly see more and more patients. Even if you feel like you don't have enough time to do all your charting or to give time to your patients, that doesn't really matter much in the long run, because they have a certain dollar figure that they need you to meet, and they're going to be pushing you for that. So again, I'm not trying to dissuade people. It's just the reality of what it's like working in medicine right now. And then on top of all of that, you have to add the stress factor of the fact that you are dealing with people's lives and their health. And it's scary, especially when you first come out. Your first year is going to be hell for the most part, most people. Some people land in really amazing situations. They have great mentors, and that is certainly possible. But for the most part, and you'll see that if you look on forums or different things, people in their first year are struggling. And most people end up in tears many times during that first year, because it's just what medicine is. There's that growth spurt. And then for the next 5 years or so, it will take you that long till you're really kind of comfortable and confident, for the most part, usually. So you have to be prepared for that and know that PA school is hard, but it's not just getting through those 2.5 years and then you've got it made. You have to get through those 2.5 years, and then you've got to buckle down some more and get through the next, 5 or 6 years. Again, I'm not trying to drive everyone away. I just want people to think about this, because if your heart is not for working in medicine, if you are on the fence about whether this is something that you want to do, then you really need to give it some real thought. And I suggest that everyone try to shadow at least 2 or 3 different medical providers, whether they're PAs, NPs, or physicians. It doesn't really matter. We all kind of do mostly the same job. And ask them ask them what their pain points are. Excuse me. Ask them what their struggles are, what they like and dislike about medicine, and really pay attention to all of the work that they have to do that is beyond just seeing the patient, because that's going to be That's going to be your reality if you become a PA. So just make sure that you know what you're getting into before you step into it. And if you're kind of thinking about, going to PA school because you want to work in medicine to make a good salary and, to have a stable job and be financially secure, that's great. I mean, that factors in, I think, anyone's decision to go into medicine. But if that's pretty much what you're doing it for, I would say, think long and hard. There are lots of ways to make 100 grand or more per year in this world that does not involve the stress of medicine. Um, so anyway, if anyone's still here and wanting to become a PA, I'll go on and talk about other good things about it. Um, well, actually, let me just share a little bit of my struggles before I go on. And I have a video kind of talk about this too. But I was in my undergrad program, I graduated from an honors program with a 4.0. So just, I don't brag, I'm not bragging about that. I'm just letting you know what kind of student I was. And then in PA school, I was solidly in like the top third of the class probably. And I came out hoping to find like a good mentor situation, and I thought I had found one, but it really wasn't. It was a solo physician, and she was so busy that I was lucky to get like 5, 10 minutes a day with her. And I was working rural medicine with these really sick patients and things. So I struggled through that for a while, and then I went to an urgent care clinic, never having worked urgent care before, worked a lot by myself again in a different setting. And they pretty much had the stopwatch on you. When you logged into that patient and when you logged out, you needed to have everything done in 15 minutes. And they met with you all the time and talked about your numbers and your time and stuff. And I left there because I'm like, that's not how I practice medicine. So I left there and I'm like, what is going on? I've never failed at stuff in my life. I'm a competent human being, but I really felt kind of beat down by medicine. So then I started working locums, which I think is a great alternative for people if they don't have to have that, full-time income. Or you can make it full-time, but if you do it like I did, I would take a break, several weeks, and then I would work, and then I would take a break for some more. And that kind of helped break up some of the burnout that you get in medicine. Um, but then I was trying to figure out where my fit is in medicine, because I think that every personality has an area that they fit in medicine. So that's something to think about when you're on rotations, either the rotations you have or when you're talking to your classmates who have different rotations, and kind of try to figure out what might fit your personality better. Some rotations give you more time. I mean, I'm sorry, some specialties give you more time with the patients, and other ones, you have to move through them pretty quick. Like dermatology, people may be surprised to learn that on average, people usually see about 45 patients a day in dermatology, in an 8-hour day. And it's they have scribes and they have ways that they can get through that many, but it's pretty, fast turnover, versus like if you work in sleep medicine or maybe even psychology, those are slower, practices as far as you have more time with your patients. So keep all that in mind too when you're trying to decide what it is that you might, want to do in medicine. So it's difficult, and there are struggles in medicine, but I do believe that most people, especially if you have a heart for working in medicine, can find where you fit in medicine that's going to give you a very satisfying career. And I talk to people all the time who love their career, and there's no accident that the PAs and NPs have been voted some of the top professions in the country throughout the years and stuff. So I just want to give you a balanced perspective. And last, I want to talk about patient care experience. And I see people ask this all the time, pre-PA students that are like, um, will this count? I work at, I'm an ophthalmology tech, or I, work somewhere. Will this count as patient care experience to get me into PA school? And the focus is always, will this get me into PA school? Will this be accepted? And that is totally the wrong focus that you should have. So like I said, went into medicine late. I didn't work in medicine in any capacity before I started undergrad. And then when I found out you had to have patient care experience, I ended up working as a tech in a children's hospital, like in the day surgery center. So I would take vitals from the kids and kind of get them checked into their OR, I mean, to their pre-op bay, and make sure, we had all the paperwork done and kind of control the flow of the pre-op. And then in the afternoon, I'd move over to post-op, and the most medical thing I would do is take the little IV out of their hands and put a Band-Aid on them. I'd give them popsicles, but that popsicle skill never came into to use in PA school and in my career. But I didn't learn like a whole lot there. So I did myself a real disservice. I mean, I got into PA school on my first round. I got into two of the three schools that I applied to. So that experience definitely was enough, but it didn't help me at all. In fact, it hurt me, and it was harder going through PA school. So you really want to look at your patient care experience as a learning opportunity to learn as much as you can before you go to PA school, not just to hit that number to qualify to apply to PA school. And there's the top three patient care experience that I think now, like looking back, would have been great to have. And number one is being an EMT. Even if you're not going to go into emergency medicine, if that's you have no desire to do that, it doesn't matter. You will learn, you will use the skills that you learn as an EMT in just about any practice that you work in. You're going to learn how to read EKGs. You're going to learn how to deal with people who are hurting and suffering. And because that's totally different than dealing with the general public on day to day, or out, somebody comes into family practice and they're doing fine, and it's easier. But when people come in and they're struggling to breathe, or they're having some issues, you need to know how to deal with people, and you need to know how to move them and position them, like if they're in a wheelchair and things like that. That stuff sounds like easy, but it's not if you've never done it before. So EMTs, you get a lot of great experience with that. You'll learn how to start IVs and um, to take vitals in a distress kind of situation. You'll learn what is the emergent things, like what do you really have to pay attention to right now, and you get that kind of sense about what is urgent and what is not as urgent. And again, that skill will come in handy. That skill will come in handy in any of the different specialties that you work in. The second thing that I would suggest is becoming an MA. And there are, MA schools that you can go to, but there are places, you might have to knock on a lot of doors, but there are places that you can get in and be an MA without having to go to school and get a certificate or anything. But if you're an MA, especially like if you're in an outpatient clinic that where you're talking to patients, getting their history, reviewing their medication list, you're going to get familiar with medication names. And even if you don't know exactly what they do, you'll get an idea of the common medications that people are on. That is so much easier than when you go into pharmacology, like me, not hardly knowing any medications, and you have to learn all of them from scratch. So that helps you in that aspect. You also will be taking a history from the patient and, writing that in a chart note, so that'll give you a chance to learn how to, kind of take a history and to be able to consolidate that well into a note. Again, taking vitals and assisting providers if they're doing procedures and stuff. Sometimes you can help them with that. And also just talking with your providers, and especially if you work in a clinic with really nice, providers, and they know you want to go to PA school, they often do a lot of training and will talk to you about cool cases they see. You can do, a lot of times MAs do the medication refills, or send the patient the lab results, and send on what the provider, the provider will tell you to tell them that, oh, this lab is high or low, and this is what they need to do. So you can learn some of that and have some familiarity with what the labs look like. And then Finally, you can read their notes. It's invaluable if you ever have the opportunity to read providers' notes, to just kind of read through them for several reasons. One, you can kind of get an idea of how the chart flows and how people are expressing themselves and how they lay out their chart. But you also can read about, the condition. You can see what questions they asked and what they thought was important to include, the history, part, and then their assessment and plan. You can get an idea of how they go about treating these cases, and especially if you see the same, like in practices, you'll see the same conditions over and over again. You'll get an idea, a good idea already of how to treat people before you've even gone to PA school. So those are great. And then the last one that I would say is being a scribe. You will be there with the provider. You will see everything that they do, hear all the questions they ask. You will write the entire chart. You'll order labs and imaging and all kinds of stuff like that. So you really get some great experience there as well. Sorry, I don't know what's going on with my voice today. So those are the top three, I think, patient care experience. But whatever you do, do your best to learn as much as you can while you're there. Ask a lot of questions, and use it as a springboard, a learning platform before you go to PA school. So those are the three topics I have. I hope that there was information in there that people found useful and helpful. Um, I am certainly willing to, I know I already went a long time, but if there's anyone that still has questions, I'm more than happy to take questions.
Yeah, I had a question. Um, do you think that the pressure from like the administrative side of things in medicine will ease because people are playing like they're focusing more on mental health, I feel recently, or do you think that that's not something that they'll ever be concerned about or try to fix?
Yeah, I do think they're concerned about it. And I interviewed a PA who works in administration now, and I asked him that question. I said, is administration, do they understand the full problem that is out there? Because PAs, NPs, and physicians, the burnout rates are increasing, and people are leaving medicine in droves right now, and it's going to be a problem. We already have, a shortage. It's going to be even more of a shortage. I just did a series on AI, artificial intelligence in medicine, and that's going to help fill in some of the gaps. But it is a problem. But anyway, I asked him about, if they're aware of how pervasive that problem is, and if they're seriously working on it. And he said, at least in his system, that it is definitely something that they are, aware of and worried about and working on. It's just a difficult problem to solve, because there are definitely things that places can do to make things better for providers. But you can't, but it all comes down to the money. And, if you have to see so many patients in order to bring the money in, that's like the biggest, issue and the biggest problem. But I think that they are starting to realize, it's kind of a joke in medicine, it's like, oh, um, meditate some more, or do take time to do self-help, or they'll bring you pizzas and stuff like that, and all that is great, lip service, but it doesn't fix the issue is staffing, having enough support staff to help you, um, respect for your training. I mean, I can't tell you how frustrating it is to have people who, they may have a business degree, they may not, but have these people telling you what you need to do and how you need to do it when they've never practiced or studied medicine in their life. So I don't know how that problem gets fixed, honestly. I think that with AI, um, that medicine gonna change a lot in the next 5 to 10 years. And so it's kind of hard to know how, all of it is going to change. But a lot of the administrative work, like charting and stuff that takes up a lot of our time, a lot of that's going to start being handled by AI, which will free us up for time. But like I said in my video, I feel like that administrators are going to be like, oh, they've got more time, they can see more patients, and so we'll be seeing more patients. But anyway, so yeah, I don't know. I think people are working on it. I think it will get to a breaking point where things will have to start swinging the other way, but I think it'll be a while. Um, so somebody asked, do you believe that working as a CNA provides transferable patient care experience for the PA path? Um, Definitely. I don't really, I actually got, before I got my job at the Children's Hospital, I did a little CNA course. It was, pretty quick and pretty cheap. But it was the first time like teaching me how to work with people, on the medical side. Um, so definitely there is great experience. It's helpful, like I said, just to be able to interact with people on a different level. I mean, I remember we had to brush patients' teeth that lived in like a nursing home. I mean, obviously, you're not going to be brushing patients' teeth as a PA, but it's just odd to brush somebody else's teeth, I mean, except for small children, somebody do that, but it's not something we do on a regular basis. So things like that may seem small, the more comfortable you are working with patients and interacting with them and helping to move them and stuff like that really is a skill that's going to come in handy. Now, I don't know, there's a lot of things you can do with a CNA, so um, you'd have to give me some better examples, I guess, but I think that you're going to be working in medical settings, and like I said, talk to as many people, providers and stuff as you can that you're around, in addition to the things that you do in your job to try to just learn more things. And then somebody suggests phlebotomy for hours. Phlebotomy is a great skill. I was thankful on my rotations at the VA. At the time, I was kind of pissed because the providers didn't really want us, there with them every day. So some days we worked with the nutritionist, and some days we were in the lab drawing blood. And so I was a little bitter about it at the time, but I do have to say that I'm glad that I did that, because in PA school, when we start IVs, we practice on this fake arm, and we only did it like it was one class period. And as long as you could get the fluid to come out, then you were, certified to do IVs. That's totally different than doing it in the real world. And the same for drawing blood. So it was great to have that experience. Is it something you're going to use all the time? Not really. There are some instances where, like, I worked at this corporate health clinic, and the PA, like, it was a very slow clinic, and so when people would come in, if they had to draw labs, the PA would draw the labs, draw the blood for the labs. So there are some times that you'll use it, but again, just the experience of being able to stick somebody, with a needle, that's going to transfer to when you have to like drain an abscess, do an I&D, have to cut, somebody into to scoop out, the material in there and stuff like that. Just learning to puncture somebody's skin is not, again, a normal thing that we do. So anytime you get some training doing that would be great. I would say I wouldn't suggest complete phlebotomy as your only experience. If it's possible for you to get other experience, I might do some phlebotomy, but then if you can get some work doing something else, that would be better. Phlebotomy is gonna get you some, but it's not gonna be like all the experience you need.
Can I ask you a quick question? I
Sure.
came in late, but I think I heard you say that you did PA school later in life, correct?
Correct.
I'm in the same boat. Any advice?
Yeah, so and I don't know, if you heard, I was in my late 30s when I did undergrad, and then I
Same.
did PA school in my 40s. And I was the second oldest one in my class, and one of my best friends from PA school, he was 35 when he went through PA school. And we talk about later, because all of us, and don't want to discourage you, but all of us older people struggled a little bit in our careers when we came out, and we were trying to figure out why. I think part of it is that when you're in your 20s, it's just you kind of feel invincible and you can do everything. I mean, and that's why, and you have a confidence even if you don't like think that you're confident. It's just a different mentality, that kind of, and don't take offense when I say young and dumb, but you haven't lived enough to know like all the things that you don't know. When you're older and you go to school and you're studying medicine, I think that you're more aware of all that you don't know when you come out. And so I think all of us are a little bit more, um, not nervous, but um, we just feel the pressure more, I think, in our practices, because we know all the things that could go wrong and we know that we've only, touched the tip of the iceberg and what we've learned in PA school. And so I think that that has held us back a little bit and caused us to struggle a little bit more. I don't know if I'm making sense when I say that. It's hard to explain, if you haven't gone through it. Um, but on the other hand, we have a lot of pluses. There's the plus of having experience, having life experience, like we talked about earlier about having, strep throat. You're older, you've experienced more things. You might have, given birth, or you have all of these experiences that you can pull on, so you can relate to patients better and better understand what they're going through and relate to life struggles more, because there's a lot of medicine that has to deal with socioeconomic problems that our patients have, and you do a lot more dealing with that than you would expect you would in medicine. You think you just learned the medicine, you got it down, but you have to deal with people's where they are in their life. And so understanding life problems, helps. And then just instant credibility. When I walk into a room, you know, I get a different reception than this poor girl in our in our class. She was so cute. She was in her early 20s. She was a small, petite little thing, this little voice. That's really hard for her to command respect, right? When you walk into a room. And so she has an uphill battle, from the get-go. She's incredibly smart, and I'm sure she does a great job, but it's just those first impressions. So there are pluses and minuses to going to PA school when you're older. Unfortunately, when I came out of PA school, I went through early menopause. So I was trying to learn after I, came out of PA school. And like I said, your first year or two, you are basically learning the real world of medicine. I was trying to go through all that at the same time I was going through menopause. So that's a struggle. If you're, I don't know what age you are, but if that's something, then you have to think about that, because it can be problematic on timing. Um, but anyway, I think that we make great students because we buckle down and focus on what needs to, happen usually, and we aren't as concerned about having a social life, those kind of things. So pluses and minuses. I don't know if that answered your question and what you're looking for.
Yeah, very helpful. I appreciate it. Thank you.
Okay, good. Anybody else on any topic? So while if somebody's thinking about asking a question, I'll just say really quick, I'm not here just to plug my channel. I hope I don't give off that impression, but the whole reason I started, this was that I wanted a place. I couldn't find resources for some of these questions I had about what options do we have as, in our careers as PAs. So on my channel, I broke them down into playlists. I've got a playlist where I interview people in different medical specialties. I don't have all of them by any means yet, but I have, quite a few on there. And we talk about, I try to ask them things like, first of all, how did you get into the specialty? What kind of things do you do as a PA in those specialties? That was a question I had, that if you don't have a rotation, you don't really know, like, what do you actually do in trauma surgery, as a PA? What is your role? What do you do? So I ask them those things, talk to them about schedule, like pretty much how many hours are you working a day? Is it, in this specialty, is it mainly Monday through Friday, or is it variable? Do you have call? Those kind of things. I try to ask people how much they make, what they love about the specialty, what they don't like about it, what the pain points are, and then what advice they would give people who want to get in that specialty, like how do you prepare yourself to work in those specialties. So that's kind of what I try to hit on those videos. And then I've got cool and unusual jobs, where those ones where I interviewed the person that worked at the South Pole, the person that works that took care of the president, all the different things about working overseas, all of those things on that list. And then I've got a non-clinical playlist where I taught people who do research, work as MSLs, those kind of things. So, and then another one just of general topics that pertain to the PA profession. So if you're looking for more things, if you're thinking about a specialty, or you just kind of want to see what some of the options are, that's a good place to go. I would gladly send you to other resources. I just don't know of a lot of resources like this out there right now that if to help you kind of figure out your career. Now, there are some other websites like the PA Blueprint is they have a book, and then they have a website that gives you a lot of good information about just being a PA and the PA career. That's run by another PA. Those are the ones I can think of at the top of my head right now. But do you ever struggle communicating with doctors, patients as a PA in terms of authority and or medical education experience? There are times when you're going to run into this, where there's going to be patients who will not see a PA. In fact, I just had somebody on Facebook, a relative of mine, that wrote back, and they're like, about something I posted, and they're like, sorry, but if I can't see a physician, then I just leave, and I'm like, oh, nice, ignorant. You don't understand. But there are going to be times when that happens, and you can try to explain to people, but for the most part, it's usually a losing battle if they have their mindset. But otherwise, I run into a lot of people who tell me, like when I tell them what I do, they're like, "Oh, I love, seeing my PA. I'd rather see them than the physician." And you get that a lot. So you've got both of those things there. As far as communicating with doctors, again, it's very dependent on the particular physician. There are many physicians who are very pro PA and NP, and consider us part of the team, and do the give and take with us, and discuss things. Like I was a locums in this one practice where the doctors would come to her and ask her questions because she just was so good and she knew what she was doing, and they valued her opinion, and they would, seek her out and ask her. And so it was a very level playing field there. But then there's other places that you work, and, the other personalities where doctors are like, yeah, you don't know what you're doing, whatever. I don't really care what you have to say, type of thing. But I'd say that's more few and far between. I'd say most of the places I have worked, it's been pretty respectful between doctors and PAs and NPs. Oh, and I do want to say one quick thing about that too, is that I am all for PAs, for us moving into, it's not independent practice, we actually call it, I just slipped my OTP, optimal team practice, where we don't have to be tied to a supervising physician. I'm all for that, just because in the real world, it doesn't change. If you have a supervising physician, it doesn't change how we practice. We're always going to, ask when we need help, and we're always going to bounce things off of colleagues and stuff. But it just removes a lot of that paperwork. But I'm also hope that people give physicians the respect that they deserve. I mean, they do go through a lot more schooling than we do. They have a lot more um, experience, especially when they first come out. Now, after somebody's been a PA for, 10, 15 years and they're doing all of these CMEs and stuff, they've done a lot of, training on their own. I would hold those people above a newly graduated doctor in my eyes. But I just hope that for young people who are going to be a new PA and stuff, that we give physicians their respect. And I mean, they should treat us with respect too. We go through a lot also, but it's just a little bit different. And I hope that people stay humble and don't forget that. All right, is that all the questions? Anybody else have anything else that they want to talk about? All right, well, if anyone thinks of anything on my channel, there is an email address there. If if you have any questions you want to send me, or if you have any videos that you want to see, just let me know.
Thank you so much.
You're welcome.